Здравейте на всички! В този епизод ще ви запозная с отново много интересен, поне за мен, човек, който работи от 13 години в Отобок. Тя е жена, за много от нас това е тема табу. Hello, Михаела, welcome to Bulgaria.
Добро утро.
Добро утро.
Thank you for invitation. I'm very happy to be
It's
here.
It's a pleasure for me. I know that you're CPO in Oтобok. And you're specialized also lower limbs and upper limb. So today I want to talk more about upper limbs because we know something, but we want to know everything. So I think that you are the right person. Can you first share your story with us? How you become prosthetic technician?
Yeah, I would like that. So hello everybody. My name is Mihaela Fluenesco. I've been working with Oтобок, Romania for 13 years now. When I started, or when I was thinking to choose my profession, I definitely was interested in a field which would be technical, but which would also put my mind to work. So I wasn't very keen in what most of my colleagues thought as a popular profession.
Of course,
so
like every one of my friends.
Yes, there are certain professions who are a big success to the young population. But I took a list with the universities in my country, and I was looking for something out of the usual, something interesting.
Helpful also.
Yes, obviously helpful, but I really do believe that every profession is helpful and every profession helps another person. So it wasn't about that. So I saw somewhere medical engineering as a subspecialty prosthetics. I had no idea what was that. So I went for it. I was accepted, and this was the Faculty of Medical Engineering. So I did 4 years of bachelor and then 2 years of master in medical engineering.
Master also?
Yes, I did also, and I still need, maybe today, I still need to explain to my parents what this exactly mean. So you can imagine it was exactly what I aimed for, something out of the ordinary and interesting.
Okay, seems very, very interesting.
Of course, during my studies, I got to understand what the difference from prosthetics and orthotics is. So, yeah, just to make clear for everybody, the orthotic is helping healthy segment of your body, and the prosthetics is replacing.
Exactly. Yeah.
Yes.
Yeah. We have to know that. What about this medical university? What you are studying there?
So medical engineering has 4 branches in the faculty I followed. Which was medical electronics, management in medicine, prosthetics, and dealing with medical substances, like similar to pharmaceutical, but not the same, yeah? So after you finish the bachelor, when you choose your master, you will really go for your subspecialty. And in my case, it was prosthetics. The curricula was mainly theoretical. When they talked about prosthetics, they were focusing more on implants, so prosthetics that you get inside of your body. Trainers or teachers or professors were the same almost as for medical school. They weren't specialized in prosthetics. So I had a lot of courses, same as colleagues from medical school, but really compressed to a few months or semester, a few weeks,
and the tools and
which is incomplete, obviously.
Yeah,
it's a very wide domain. Furthermore, you have the mathematics, physics, biomechanics. So Medical engineering and prosthetics, it's a combination of a lot of fields. So they just gave us the basics, a little bits from everything. So after 6 years, I knew nothing.
Nothing for prosthetics?
Nothing practical.
Yes.
Nothing really about prosthetics for amputated people. I learned about the anatomy, about the biomechanics. I learned about the pathology, the causes of amputation, the surgical techniques. So I learned that. But this is a very good information that would help me to have a conversation with the surgeon that is doing amputations. But I wasn't prepared for working into a workshop. I wasn't obviously prepared to work in an R&D department. That's why I said I felt like a practical part of these studies were completely missing. After I finished the studies, I was lucky to find a job at Oтобок. So when I first met Oтобок was when I was searching to do a practice, because I don't know how is it in Bulgaria, but when you have
yes, you have some more practice.
Exactly. So I started calling companies. Some of them was about to shut down, so they said, sorry. Search in another place. Other companies who now I go to give trainings, other companies said to me back then, sorry, we don't accept students because we have a closed chain of information and like a secret. Okay, no problem. And then Oтобок was next on the list. Obviously back then I didn't know who is which, this company is a producer, this company not. I didn't know. I was very new. I called Oтобок. They were interested to collaborate with students.
Nice.
We are still interested in collaborating with students. So still up to today, we have students for summer practice. Maybe we cannot do that every year. Sometimes we have to say, sorry, this summer is not possible, but generally we are open. They accepted me, so I went for 3 months.
Okay, this happened after your master degree,
This happened between first and second year of master, the summer practice between first and second year. You have to do like 3 weeks, I think, but I loved it so much that I asked if I could stay the whole summer, and they said, yeah, nice.
Actually, you're staying there without paying or nothing, right?
No, actually the manager was fair, and because I also participated in some projects.
Nice.
They taught me everything. I had very nice colleagues. My first mentor was still with Oтобок back then, and I really learned everything. I always say my first mentor teach me how to hold a hammer and the Allen key. You have to consider I had to learn everything, how the tools are called, what you use each one for what. This apart from the technology, the prosthetic technology.
This medical university and actually you're studying, it's nothing similar to what is to be in facility where is producing prosthetics, right?
Yes, it was not close to reality even by far. During my summer practice at Oтобок, it was the first time I saw an amputated person. I think there I learned the difference between prosthetics and orthotics. So yeah, I had a lot of people really contributing to my development.
Then you wanted to stay more. Yeah, after the third week, you wanted to stay.
Yes, Oтобок, it was a bigger facility. Oтобок is also a producer, so they had a lot of technology, access to a lot of information. So I really liked it there. I clicked with the colleagues and with the management. So we were in connection after this summer, and after I finished, soon after I graduated, they called me and they invited me on a team building, and I said, yes, I'm in.
After your practice, you feeling okay, you're feeling like this is your place, you want to stay there, you want to work this, you want to participate in this position, right?
Yes.
But did you ask them for a job, or
Yes,
just
I made myself very available, very interested in this profession, willing to move to Bucharest because I grew up in another town. And most important, I made them understand that a woman can do this job. So I can imagine 13 years ago, there weren't women in this field. They were, in Romania at least, female colleagues who were doing parts of the entire fitting process. But I am doing the whole process, so that's very rare. Back then it was
back in the years, I know females that making models, casts, not the whole process.
Yes.
Some part of the process.
They do lamination, whatever it was considered delicate and woman accessible. But I proved that I'm able, I'm capable, I'm willing. Obviously, I don't have your strength if we measure, but same as our patients, we female prosthetists, we find our own way to do things, to make it easier for us and to get a good result.
I can say that from 1 year now, I have female in my facility. So she is doing very, very good, very well. She went to Milano, in University of Milano. And when she came to us, she was prepared on paper, but in practice, not so much. And I was afraid that she will not accomplish everything. But now I can say that she's working everywhere, every time. So for female, it's not a problem. It's like normal job. You just have to do it and you do it.
Yes, I met Sylvia, and immediately after I told you, if you remember, I admire that you hire and we are open to having female colleagues. I told her I admire that you're willing to enter this profession, because this profession you really need to have the willing to work with, because it's physically demanding, not only intellectually demanding. It's very physically demanding. It might be very dirty.
For sure it's dirty. For sure it's very dirty. Yeah.
Now you're already dealing, I saw, with 3D printed and scanning is coming. So you are in contact with the new technology. Maybe we will soon move to a different stage in this technical development. But it's a dirty job. So you have to be willing to work in an environment like that and to come in contact with chemicals, disregard the protection equipment. Yeah.
Yes, but even in 3D printing, there is a finishing job that is a little bit dirty.
Right.
We cannot escape from
we cannot completely cancel it.
Of course, we cannot. We are doing our best to save us and the final result to be okay. So, what about the college of Oтобок?
So my studies did not finish after these 6 years with university. After I was hired at Oтобок, because we are multinational and such a wide company, we still have a lot of internal trainings. Some of them are short and they are focused on a product, for example, so it might take a few days. Others, they are focused on topic, so it might take a few weeks. And others are quite longer. So the longest training I had with Oтобок, it was 1.5 years, but half year was at home, online, theoretical part. And 1 year was in Duderstadt, Germany. It was fully practical. So finally, my dream came true. I had fully practical training. During this 1 year, we went through every amputation level of lower limb, from partial foot to hip disarticulation, and for each amputation level we had real patients, so demo patients. They were hired by the company to resist our
It's
learning
normal.
process, which I'm very grateful to them. It wasn't easy for them because we had to learn how to do the entire prosthetic fitting process, from casting, test socket, alignment, definitive socket, gait training, everything. So we ended up with more than 20 complete fittings. So
More
we
than 20.
more than 20, I think it's 22, 24, I don't
Yes.
remember.
This is like for 1 year per person.
For 1 year, for each student, combine or adding all of the amputations level. So we did a partial foot, we did below knee and so on, knee disarticulation, everything. Every time for start to the end. For the most common amputation levels, we even had different methods, different techniques of creating a socket. So we paired up different patient profiles. It's not like each of us had only one patient. We had multiple patients. We were rotating the demo patients. So we came into contact with different patient profiles: age, mobility degree, lifestyles, demands, needs, different diseases or syndromes, causes of amputation.
Of course, yeah. So for 1 year, you are studying lower limb and upper limbs prosthetic, or it's separate?
This 1 year that I'm talking about, it was for lower limb. Then after some time, I took a training on upper limb. It was shorter, but still I had demo patients to work with and complete process.
I think that we can discuss a little bit more for bionic arms. Doesn't matter which type of amputation we have, but can you explain us what is in first place for some person to have bionic arm? What sits in first place? Because I know that it's not for everybody, cannot be just for everybody.
It's true.
So what we have to have?
Yes, so there are, we call them myo-controlled prosthetic components for different upper limb amputation levels, starting with partial hand amputation, then wrist disarticulation and so on, even going up to shoulder disarticulation. So on the market there are myo-controlled components for basically every level of amputation. What bionic means? Bionic means that the prosthetic device is very complex and the functionality of it really mimics in a high level the physiological. But these bionic components, they are myoelectrically controlled. What does that mean? Is that by contracting your stump muscles, you will send a signal to the prosthesis. So there are some little parts, very important one, called electrodes. They only touch your skin. They are not invasive. They only touch your skin. And when you contract your muscle, these electrodes will pick up a signal and they will transfer it to the prosthetic components. So the first thing, we need to evaluate the patient to see if the patient is able to produce a strong or separated or clean enough myo signal. Everything about this is about our body is with energy. So the same thing happens when I contract my muscle. I give an electric impulse. So I need to evaluate if the patient has. When the patient is not able to produce this, very often with patients who had amputations due to electrocution or burned patients with heavy scarring tissue, because then you cannot really read the myo signals.
Exactly, there is no clean signal.
Or not a clean surface. If the surface is irregular, you cannot place an electrode parallel really to the surface, and it cannot pick up signals.
There is any possibility to train the limb before we get the prosthetic? So if we take a measure and there is no clean signal, there is some problems, is there a way to train this limb so it will be able to make a good signal?
I would say it's a must. It's a must. It doesn't matter the level of amputation, upper or lower. Every time there is a step before the prosthetic fitting. And in many countries this is overlooked. We don't have professionals, or the patient is not informed about, or they cannot afford it. But every time a training before amputation, it's a must. And furthermore, into upper limb when you are targeting myocontrol prosthesis. Yes, the evaluation takes very short, maybe half an hour or something. So you don't really read the full potential of the patient. The goal of the assessment is to see if there is a possibility, a base from where to start. And even if you don't obtain anything on the first consultation, you might choose to have a few more, because maybe the patient is nervous. Maybe the patient was using for many, many years a cosmetic prosthesis or no prosthesis at all. So you have to give time to the patient. Sometimes, if not always, it's very helpful to have a physical therapist working with the patient to help the patient understand how to consciously use muscles. Because, we do a movement. We don't think about it. It's intuitive. But a physiotherapist would train the patient how to target a specific muscle group. Exactly, that's what we need when we are using a myoprosthesis. And after that, you still need to continue the myo training, so without a prosthesis even, to have strong muscle contractions, separate muscles contraction, because we have a group of muscles that would do a flexion, we have a group of muscles that would do an extension, so we need to train and separate. When the level of amputation is very high, then you need to control a lot of joints.
The weight of the prosthetic is going to be more, and it's going to be harder to control, but it's not impossible.
That's a good point. I will talk soon about the weight of the prosthesis. With muscles group, you need to switch in between different components.
Exactly.
So that's why you need to train them. Regarding the weight of the prosthesis, actually the weight of the prosthesis is a beneficial thing. Obviously, we need to have compatibility between the weight of the prosthesis, the functionality of it, and the body type of the patient. That's why there are existing children, pediatric components. You cannot put an adult, not just because they are big, but they are heavy for a small person or a child. But actually, it's very important after you undergone upper limb amputation. It's very important to have a prosthetic device attached to your body, because I will go immediately into this because it's very important. It's important to have a prosthetic device because it will level up,
of course,
your body.
Yes.
If not, for example, if I have the amputation on this side, soon I will have an imbalance in my shoulders and spine deviations, and the prosthetic device with its weight will balance.
So my opinion is that even if patient cannot afford bionic arm or whatever arm they want, cosmetic arm, it's balancing the
They're
body.
very important.
Yeah, in the way that should be.
Yes.
If not, there is deviation on the spine, and I don't know the reverse process, how long it will take, and if it's possible.
Correct, I agree with you, yes. So, this does not mean that the prosthesis should be as heavy as the segment you lost. Because actually the segment you lost it's a lot heavier than you think, but because everything is connected to everything, you don't feel the actual weight. But it's important for you to have some weight there to prevent contractions, to prevent deviations. And I totally agree with you. The correction process, it takes forever. It should be continuous, and maybe sometimes you reach a point you cannot correct it anymore. It's because of the age or other factors.
Yeah, but it's not only deviation of the spine. This deviation comes with pain, neck pain, maybe back pain.
Totally.
Maybe headache.
Gait deviations. Yeah.
It's part of us, and if we are born with two hands, we have to stay with two hands all the time.
Yes, and then of course it's the talk about functionality. Even a cosmetic prosthesis can help you support an object. The body image, it's improving a little bit. Then there is the sense of touch, which up so far you cannot reproduce it in a medical device.
In my 16 years career, like CPO, many times I take questions like, I know that there is movement, robotic movement, but each finger can move. If can I control this with my mind? I'm starting to explain how it works, but what is the futuristic thing in the upper limb prosthetics?
I get the same questions.
Yeah, it's
all
normal,
colleagues get the same questions from the patients. Yes, so when you think about upper limb prosthetics, you think about how to control them. And nowadays, the question, can I control it with my mind, is not so science fiction anymore. For example, Oтобок has the control unit called MyoPlus. So this is prosthetic components that is dictating the hand, so the terminal device, how to react based on information from patient. So basically it's still about contracting your muscles, but in conventional prosthesis, myoprosthesis, we have at least one electrode or maximum 2 electrodes. So they are placed on the skin, and I need to picture how I move my phantom limb. So this means the part I no longer have. So we need to train the patient to contract this area. So we tell them, imagine you are doing this. And when they are doing this in their imagination with the phantom limb, what's the result from the prosthesis? The hand opens. So if you think about it, I need to imagine this to get this. So it's not the same, yeah, it's a paradox.
Yeah,
so
you have to learn the movement, not to think about exact movement
yes,
that you want to do.
This means I have a learning process ahead of me, and I really need to overwrite the effect I hope for. I had to overwrite it with what I need to do with my stump or with my phantom limb. But this MyoPlus control unit, it's the technique behind it, it's called pattern recognition. What does it mean? So I still have electrodes, but I have a lot of electrodes. I have 8. So 8 electrodes, they are going all around my forearm, because MyoPlus currently it's for the forearm amputation, so below elbow, even wrist disarticulation. So I have these electrodes, and because I have so many everywhere on my muscles, I have just to picture, if I want to open the hand, I have to picture that I'm opening the hand. So this means that I'm really using my brain, of course, yeah, as I would do for a natural limb.
Yeah. So
same for closing, same for different hand gestures. But you need to have a hand, like for example, be bionic, that would be able to provide these hand grips, different hand grips.
So the patient just produce movement that is natural.
Yes, the movement you would normally picture in your hand.
Yeah.
So what you picture in your hand is what the hand is doing. But attention, we are talking about the hand. If you picture in your hand doing this, the wrist won't do this because the wrist is another component. But MyoPlus is controlling only the hand. So from here with the fingers, palm and finger. You still need to train. But it's easier, and the system adapts to the patient. It's not like the patient needs to adapt to the system. That's the difference.
Very nice. This is futuristic, and this, I think, it's very easy to learn how the software is working.
I wouldn't say it's easy, but it's more intuitive. It's you get a larger number of patients to learn how to use a prosthesis, and the process it's easier than the other, but you still need to train.
Okay, so in this kind of amputation, we expect from the wrist to rotate, and from the phalanx just to grab, to open, maybe positioning something.
Yes,
like this, right?
MyoPlus allows you to close the hand and to open the hand, and indeed you are right, the fingers might have a different position, and it also allows rotation from the wrist, so palms up, which is supination, or palms down, which is pronation. This is what MyoPlus is doing. If you think more into the future, it will come at some point. What else do you need? You need to become in contact with water. Our hands is the part of our body which comes the most often in contact with water. So this is another thing that future will bring. Then it's about the sense of touch. There are some projects going on.
I saw one project in Australia that they extract your nerves into the skin, and by attaching some electrodes again, actually the patient can feel that without seeing. Is a hard material or is soft?
You get some tinglings in your
maybe
stump.
Something like this.
It tickles you in some way, and then you know, touching the object. Is it soft? Is it hard? Yeah, it's about that. There are also some surgical techniques which are called muscle reinnervation. This means, so every muscle reacts because it has a nerve attached to it or which controls it. But when you have an amputation, it might happen that that nerve goes jobless. So we need to give him a job. So basically it's like you remove it from one place and you insert it in another place. Just to make things very simple. I'm sure a surgeon would have more to say about it. But just to keep everything very simple, it's you take a nerve and you give it another job. But the brain would know, I want that movement, so I have to tell to this nerve that I want that movement. But now this nerve, it's connected to another muscle. So this can be very helpful if you think about upper limb prosthetics, because basically you would place the electrode there. And this targeted muscle reinnervation is very useful for shoulder disarticulation, because then you need to place the electrodes on part of your upper body, in front and in the back, and we are not all of us Arnold Schwarzenegger to contract our pecs and everything. So that's why muscle reinnervation is very useful, very helpful, because now the patient would be able to contract a muscle that it's important, we are using it, but which is not so very strong as the muscles we lost.
Okay, what about elbow? You provide myoelectric elbows, right?
Yes, there are. So we have functional hands, functional wrists, and of course we need and we have in Otobok's portfolio functional elbows. They work the same as the hands, so they receive myoelectric signals after I contract the stump muscle, and this translates into movement. What do I need from my elbow to bend and to extend? So I can do that also myoelectrically with dynamic arm. Of course, there are another features necessarily, like I need to be able to position my elbow in a rotational movement. This I do mechanically with the help of the table or the other arm. I need, when I walk, I need a nice movement, not everything to be stiff. The elbow has programs inside which allows to adapt the prosthesis to different patient profiles. Some patients are not able to produce multiple signals, so we have a program for that. Some patients have weak signals. We have a program for that, or even the elbow it works with a software, so the prosthetist is setting the elbow inside a specific software, so the patient has nothing to do with it. But then I can really boost up the signals. Or the patient has no signals, and then I connect another components like switches, like a press switch or a pull switch, and I activate the switch with my shoulders, and then I get an electric response from the elbow. So there are a lot of possibilities.
So what about this, that most of the patients are afraid that they cannot put on the prosthetics in the right way, so they will not work properly? Is there any question about this, or is not a problem?
The prosthetic fitting process should include training on how to use the prosthesis, like how to put it on, how to take it off, what to do with it after I took it off, how to switch it on, switch it off, how to charge it if we are talking about electric components. So these are ideal trainings we need to do with the patient. It doesn't necessarily mean that you always need to have help. There are a lot of patients who are able to don and doff the prosthesis by themselves. There are even shoulder disarticulation patients who can do that. There are even bilateral patients who are able to do that. Indeed, there might be cases where a person would need assistance, but there are training methods for that as well. Our goal as prosthetists is to come with the patient at its maximum potential. So we would always, besides choosing the right components, we would train the patient so they could reach their maximum potential. It's not the same level for everybody, but that's a prosthetic process.
Okay, so how much is the percent of success about each one for the upper limb? So I mean myoelectric hands. How much is in percent the success?
For example, I had a success rate with patients who were without prosthesis for 20 years, and now they are using a myo. This is in regard to when to have a prosthesis. So some colleagues think that I should start with cosmetic solution and then move to myo. I would say go for it as soon as you can. What does it mean as soon as you can? Of course, the medical opinion is very important. It's different for patients with diabetes, for oncological patients, for trauma patients. But given that prosthetic fitting has stages before constructing the medical device, then you can start pretty soon after the amputation. Usually after you remove the wires from the surgical suture, if there is no other contraindication from the medical doctor. You need to think it logically. What do I need when I start a prosthesis? I need to protect the wound, not for it to be open again. This doesn't really happen with upper limb because you don't have pressure on it per se. But even for lower limb, there are methods to protect the wound. So people or amputees or medical personnel should not be preoccupied about that. What else do I need? I need to desensitize the stump. How do I do that? It will not happen if I just lay on a bed. I need to touch it to make the distal end of the limb aware and to prepare it for contact with prosthetic device. So the sooner I get to do this, the better. Then we need to think about volume management. So if you leave the stump be, it will swallow up. The circulation will be affected. So you can put compression socks, compression bandage, silicone liners, but actually the prosthetic device will help to have a healed and stable stump. Of course, you need to do a correct medical device, but actually it will also be beneficial in the healing process because it can help with phantom pain. For example, for upper limb, you need the phantom sensations. It's not helpful if they are painful, but you need the sensations. Why? Because you are using your phantom limb to learn how to control the prosthesis. So if you wait for a longer period of time, you might lose the connection with your phantom limb, and this will make the rehabilitation and the training process with the prosthetic device very difficult. So phantom sensations, especially in upper limb, is something very beneficial. It doesn't mean it's something wrong with you if you see your a body segment is missing, but somehow your brain is picturing it or you feel it. No, this can be very useful for having the prosthetic device. So talking about percentages, I really took a detour in answering your question. The percentage really depends on how much the patient is investing into the rehabilitation. So we need the patient to be willing to cooperate, to have a constant connection with us. So we need to see each other a lot of times in order to have best results. Then it's a matter about each person's potential. Sometimes patients can do a lot, but they are so discouraged. So then again, we have to think even about psychological therapy, not only physical. They are so discouraged that they can never reach their potential. Either they are disappointed by the situation, they don't have a support system at home, or very many other reasons. Of course, financial is very important, but in these 13 years, very often I saw people who couldn't afford a specific complex components, but they did much more with basic one because of their willingness and their cooperation. There is not a fixed number, a fixed percentage. Maybe there isn't a statistical percentage because the most part the patient is responsible for. There is no prosthesis that will act or be driven in any other way but by the patient. No matter how futuristic, how expensive, how complex, they are not acting by themselves, but they're acting as a result of the patient body.
Exactly, it's the same like for lower limbs and it's the same for upper limbs.
Yes.
If the patient wants to do it, it will do it anyway.
Yes. Don't get me wrong, when you get complex components and you are an active person, then you will benefit out of it. You will be able to do a lot of things and do them correctly without energy expenditure, without body compensations. But it's in every case, it's about how the patient controls the prosthesis. There are a lot of factors coming here. You need a good and dedicated prosthetist professional. You need a team of therapy professionals. Of course, it's a must that everything was successful during the amputation surgery. There are a lot of factors, but the most important, and which has the largest number of percentages, is the willingness of the patient.
Okay, what about partial finger prosthetics? They are made only for aesthetic looks and for cosmetic.
I'm happy that you brought this into the discussion because I think both of us are coming from countries that has a lot of people doing stuff at home. Yeah, we are countries who really like to build stuff and do everything on our own. So this means that very often we have home accidents or even work-related accidents that will translate in losing some fingers, part of the fingers, part of the hand, part of the palm. And if we very often see people around us with half finger missing, but almost never a prosthesis.
Almost never, yeah.
Almost never, because they can manage without a finger or two.
Yes, they can.
But there are solutions for. There are two types of solution. A silicone prosthesis, which basically complete the missing part. You just add it on the stump like a glove. Let's compare it that way. If it's finger, it will come only into the finger you are missing. If it's partial hand, it will be like a glove. Every time the other remaining parts, we will keep the functionality. And these are cosmetic, but you can still pick up some things, put objects on it, so there is a functional part, I would say. And then there are the functional components. There are some mechanical fingers available on the market that you can attach to the stump and move them. There are even myoelectrical solutions for partial amputations.
Yes, but they are not aesthetic. They look like robot
yes, they
fingers,
look very
hands.
technical.
Yeah,
yes.
So there is no mixture between both. I mean, if it's for cosmetic, it stays just like for cosmetic. If a patient wants a movement, so it's gonna look like robot or something like
yes, you don't even have a cover on them. I mean, we don't have in Oтобок portfolio functional fingers for partial hand amputation. But yeah, they look very technical. You have to decide with the patient what are the priorities. Functionality means more to me, or aesthetics. If you go for aesthetics, you can have amazing natural deceiving looks, really like an art. It's unbelievable, so many details, and the process is basically to copy the
positive.
Yeah, the opposite, the contralateral side, if it's present, and to really add on the details of that specific person, and the results are unbelievable.
Yeah. But the question that every time came, it's I want to be with movement and I want to look naturally, so
you can have two prostheses.
Yeah, maybe yeah. This.
But I would say we are not there yet. Lately, I think you also saw in Leipzig, technology is moving so fast, and so again, for everybody to know what Leipzig is, there is exhibition where producers of medical devices come from all over the world. So it's not only in Leipzig, but it's in other countries as well. But Leipzig is the closest in Europe. I mean, the only one in Europe. We've seen in the last 2 or even 3 editions how the upper limb field really is in focus.
I can say
and
the same. Yeah.
yeah.
It's improving. I remember maybe 8 years ago when I went there for first time. They have only the standards bionic. I think that already was on the market.
Yeah, it's not that new.
In May this year, I was amazed because in each section I see new hand, new hand,
Yes,
new hand.
yes. In every corner you
In
see.
every
and
corner, yeah. Then I saw some Italian company that was offering 3D printed arm that you can change very quick the tools that you need.
Yeah, to adapt it.
To adapt it, yeah. And I think this is the future also because it will be more affordable to the people because the cost it will be less. For arms, I think that this can be improved in the future, very close future. For bionic arms also, for bionic arms.
Yes,
There
it's
is a
coming.
choice. There is a choice, for sure there is a choice. So here in Bulgaria, if we have a patient who want to just make a test, if it is gonna be able to control, can we ask you to come here and to make a test?
Yeah, it's always our pleasure to work together with orthomedics, and
Thank you very much.
definitely it's possible. We will schedule it. We will have together a meeting with the patient. I think we make a good team, and I like to exchange ideas with you. You are very experienced as well, and we would find solutions for the patient. We would create a plan, what is needed to be trained before the building the prosthetic device, what we will do with into the mid fitting, like with test sockets, and then also there is the training after you build the prosthetic device. So we can collaborate on that, and there are a lot of tools that help us evaluate the patient and improve the initial outcome.
Yes, we are trying to stay updated, but this depends on the patient that we have and again on the financial part. But I will be very glad if we can manage to do some arms. I mean bionic, of course. Any advice to our viewers? Doesn't matter if it's for upper limb, lower limb part.
I have, and it's more like message to the viewers. So if there is anybody watching us from the medical field, either is surgeon, nurse, or therapy professional, my message is please be aware that we are open to collaborate. Please talk with us, with the prosthetists, because we have the same interest as you. This is the benefit of the patient. So please be in contact with us for this process. I have another message for the family of the patients. Your support is much valued. It's very important. You have it very difficult, no doubt, but you are the second most important factor in the success of the fitting. And of course, the message to the users, to the amputated persons, is don't give up. Do not believe there is no solution for you. Come to us and ask us. We have a lot of solutions to offer.
Yes, my message is copy-paste is the same. I will be very glad if like doctors and therapists, doesn't matter who, but from the medical community contact us, and we can collaborate, we can be useful each other. It's gonna be more easy for the final result. It's gonna be more easy for the patient, for us, for them even.
Yes.
And this is very important because it's not just separate steps. There is step by step to the end, and we have to communicate. It's like a marathon. It's not only make amputation then go somewhere else and do things there.
Yeah, the sport parallel is very important because when you look at the athlete, the result is not only his. He has a team behind, and
Exactly,
he has a team from different areas. But they work together, and so the athletes comes to this result. Is the same in prosthetics. The medical aspect, the physiological, the psychological, and the technical aspect, they need to work together to have a good outcome. I would like to add another thing, even when we think about the financial aspects. This is another message for the end users. If you are concerned about the financial aspects, there are again possibilities to access components. So don't think that there's nothing for me, I would stay without the prosthesis. Come and talk with the prosthetic center, because there are a lot of prosthetic solutions. They are price-wise different, and chances are there will be something for you.
Yes, for sure. Because I think that if the patient is trying to search the solution, it will find it anyway. And like I say earlier, there is a 3D printed prosthetics that they are not so much, and this is just a start. Maybe after a few years the patient's gonna be able to afford something new, something good, not to stay without prosthetics.
That's the worst you can do. Stay without prosthetics, that's the worst you can do. Yeah.
Okay, thank you very much.
Thank you, Daniel.
I hope that we can see you again soon.
I would love
with
to.
New information, or maybe with something that we can show off.
Yeah, I would love to, definitely. Yeah. Thank you.
Thank you. Надявам се епизода да ви е бил интересен и да сте останали с нас до край. Благодаря.